I think one of the main problems is that we're just using the wrong metaphor when it comes to healthcare. It shouldn't be an issue of insurance. Insurance is meant for things like natural disasters or things that you can't plan for or are unexpected. Health is something we all need. It is something that if we get it sooner, it's actually less expensive, right? In addition to being better for us, right? Getting that cavity filled that prevents dental decay down the long run is so much less expensive, let alone morally the right thing to do, right? And better for us as human beings. So if we actually are thinking of health as really a human right, insurance is just that's just the wrong approach. Economically, it's totally the wrong approach. When we're talking about businesses, I'm very fortunate to be part of one of the largest unions in the world, probably, let alone the state and the country. And my husband works for a small business. We have the exact same list of health insurance plans to choose from when our open enrollment runs along. The same plan costs me to cover our whole family $0. It costs my husband thousands of dollars as a monthly premium because he's in a small business. So if you think about just these payment structures, the waste that's in the system, the spaces that the large corporations can squeeze small businesses, that really also ties folks in, as Dr. Hussein was saying, it ties folks into these employer-based systems, and then we don't have the kind of freedom to make choices about where we move, how we, what kind of work we do in the world, whether we go part-time. I think one of the real criminal things that we do in our country is we don't support families. And if you think about the kinds of caregiving that's been discussed on this panel tonight, caregiving takes time. And if we have to be working full time in order to have access to our health insurance, that means that sometimes our elderly family members, our children, our disabled family members suffer. So if we think of it from this perspective of really realizing that health is a human right, we'll realize that insurance is just the wrong approach. And something like CalCare, where we're saying the state has an obligation to provide this service, that actually is the right thing to do. It's the right way to approach this kind of problem.